Hello, my name is Dr. Ross Perry. I'm here to talk to you today about problem skin, particularly in relation to hand washing. If you have eczema, psoriasis, contact dermatitis, or a skin condition that makes your skin, particularly on your hands, prone to dry and cracking, then I'm just going to give you a few tips on how to sort of look after your skin. Particularly in this current climate, we're washing our hands a lot more frequently, which is very important. In terms of looking after your skin, it is important that you use a moisturizer. So if you're finding the soaps or the gels, the alcohol gels are becoming irritant, then it would be worth using a soap substitute instead. Often the commonest one that we tend to use in sort of people who suffer with eczema or psoriasis is one called Dermol. It works very well in terms it's a good moisturizer, but it also has an anti-microbial capacity to it as well. So that would be the simple basic thing that you can do, is really switch out your hand gels for this instead and wash with this. If you're finding that you're still not getting relief from that, then the next step would probably be introducing a barrier cream, so what we call an occlusive moisturizer. So something like Epaderm ointment, which again you can get from the chemist, and this is often a greasy, thick ointment that goes onto the area and really acts like a barrier cream. I mean, the fact that we're staying at home for long periods of time now means that you are able to wear it and put it on. Probably at night is still going to be the preferred time to apply it. Again, these are add-ons to your normal daily routine. If you find that beyond these two sort of creams or just constant moisturizing that the irritation is getting too much, then certainly a hydrocortisone cream, certainly morning and evening, and use it regularly. Often we advise that patients use any sort of medicated creams for at least a week beyond the resumption of the symptoms themselves. Otherwise you tend to get a rebound effect. If you're finding that the hydrocortisone cream hasn't worked after a week or so, then certainly there's no harm in asking the chemist for something called Eumovate cream. And this is a slightly stronger, again, still a mild steroid cream, but again can help with sort of outbreaks of dermatitis and eczema. And again, I would use that for at least a week or two to make sure the symptoms are calmed down before then going back to using moisturizers. And again, this is something that you can take or go with depending on how the severity of the symptoms are. I hope that helps, and thank you for listening.